Hello, YouTube. Hello, Facebook, family and friends, subscribers. I just want to stop by. I told you I was coming back next week or after I finish my doctor's appointments. I'm going to try to make this as fast as possible. I did see 3 doctors, so it's kind of, try to give it to you as much as I can. One thing I did do, I did see my pain management doctor, and we continue to explore some options with my pain management. And my pain tolerance is very high. I've been dealing with chronic pain, since the age of 22 with the rheumatoid arthritis. And so I have tried a lot of pain medics in my day, not really opiums or narcotics, but, other pain meds. And so therefore, a lot of things don't work on me. We are continuing to visit, just various things, discuss in discussion at this point. So one day, maybe I'll give you a follow-up on that. So in having all that chronic pain, you have problems with sleeping. And I have found that one thing that helps comfort me is sleeping with a pillow in between my legs. Warm pillows better. So, I find that a good thing. Then I also seen my kidney doctor, which my kidney doctor gave me some good news. The good news was that my kidneys are doing better. They are slowly, excuse me guys, it's a little warm in here, but they are slowly getting better. It's a long treatment process, and the medication is called Cellcept. And they use this Cellcept for people who have had kidney transplants. So it's kind of like it's trying to keep my kidneys healthy and to do a little repairing of that, of the problem of my kidneys. So we're going to continue to pray for that, because I believe only God delivers and heals. So, and he does that through vessels and things and people and things like that. So, I thank God for that. That was a good report. Also, I had seen my pulmonologist. My pulmonologist informed me, because of the pulmonary fibrosis, the ILD, which is secondary to my RA, which is rheumatoid arthritis, informed me that we discussed different treatment options, because something current is going on, which is my bones. My bones are being highly affected, my major joints, because of the medication of the prednisone. Okay, so I've been on this prednisone since 2017, continuously, because of the pulmonary fibrosis, to control that as well as to help out with the RA. So because of that, it had caused damage in my shoulders and my hips, and which is a discussion we're having with the doctors on how to treat that. They are saying I might need a hip replacement, or shoulder, on my shoulders repaired, because of the bones are being affected by the steroids. My pulmonary doctor and I discussed that she's about different other medications that we can try to, other than prednisone. So, and having surgery, because no surgeon would really want to work on you with knowing that you take steroids. So, basically, I'm on 10 milligrams of prednisone, and that's a low dosage. However, when you're taking it consistently since, for years, is high, it's highly effective as far as affecting your body. And so therefore, I'm where I'm at now with it. Of course, in 2017, I was on a higher dosage because they was trying to get control of my lungs. But now I'm on the 10 milligrams. Her and we discussed, tapering it down after I finished this antibiotic because I have a small cold and a little cold that I'm trying to kick. And so after that, I'll be on this tapering down. I'm looking forward to doing the taper down. At first, I was very anxious and I had a lot of anxiety about it. A lot of fears about being tapered all the way off because I didn't want to go back on oxygen and didn't have any risk of damage in my lungs either further. So therefore, the anxiety level was very heightened. But through prayer, through family and friends encouraging me, talking to my doctor, trying to put a plan in case something, changes, made me feel a little more relaxed. Like, okay, I just got to have faith and continue to know that God has me, and that, I'm making the right choices. So, I think, trying to discover or to see if I'm going to do the surgeries will be my greatest challenge at this moment. I'm talking about the surgeries on my bones, my joints, in order for me to have a smooth mobility without a lot of pain. But I'm trying to work through it. I'm working through it. At one point, I was very emotional, but I believe I'm doing much better now. So, you all continue to pray for me. Like I said, I have not got the information regarding the sleep study because I wanted to make sure that my oxygen level, the doctor and I wanted to make sure my oxygen level do not go down when I'm sleeping. So, when I find that out, I'll give you all an update. And when I find out about the surgeries or whatever, I'll try to come back and let you all know definitely like what I'm going to do with the surgery situation, because it is going to be complex. It's going to be all about coordination and, I'm trying to coordinate all of this, and now I'm going to have a different health insurance as of November 1st. So it's going to be just a lot of things, but I know I got it. I got it because I know that God is going to help me with that. And I thank you all for listening. Please subscribe. If you would like to know, follow-ups on me, and we don't talk often, but you want to know how I'm doing so you can pray for me and just to check on me. Subscribe on your YouTube and subscribe when I send this through, so you all can keep up with me, and sometimes ask me a question. If you have a question or someone that's going through the same thing, give them my YouTube information or on my Facebook, and I'm willing to talk to people. This pulmonary fibrosis thing is something new, especially to a lot of the Black community, and so it's just as well as lupus, because a lot of people that have lupus end up having pulmonary fibrosis as well, or fibromyalgia. So if RA, sorry. So if you know anyone that's going through any of those things, I am willing and able to encourage them or give them some insight if I have that insight for them. So I'm looking forward to hearing from you all, and thank you for listening. And this is Billy Thomas signing off. Bye-bye.